A recent tribute for Rhea Childs brought together a community of public health experts who are all passionate about improving the health of mothers, children, and families.
It was Rhea who said the center needed to be in a freestanding building here on campus to have the biggest possible impact.
It's been 20 years since the USF College of Public Health's Lawton and Rhea Childs Center for Healthy Mothers and Babies opened its doors. The center was inspired by former Governor Lawton Childs and his wife Rhea's work with Dr. Charles Mahan.
Our idea was that it would be a think tank, a way to come up with new ideas and new programs to help Florida and the United States move up in the world as far as our mother and baby outcomes.
Dr. Charles Mahan worked closely with Mr. and Mrs. Childs to address the nationwide high infant mortality rate caused by low birth weight.
Babies coming out a lot smaller than the doctor thought they were.
Florida's high infant death rate was a concern.
These problems actually started in the mid-1980s. The majority of low-income women in the state were not getting any prenatal care. So we convinced the legislature to put money into county health departments and hire doctors and nurses to make sure people in rural areas and even in our cities that everybody got prenatal care.
While Mr. Childs worked on these issues in politics, Mrs. Childs recruited local communities to help improve outcomes by establishing alliances.
One of the reasons that we got a lot better was that we had, and this was Rhea's idea, was to set up coalitions around the state called the Florida Healthy Start Coalitions. And these still exist. There's no other state that has those.
She had a keen understanding of people. She really knew that top-down solutions didn't work. You couldn't do it in silos. You had to have things that were begun organically and that were begun in communities.
Prenatal care helped decrease Florida's infant mortality rate by 1/3, but there is still a lot of work to do.
We're now trying to better understand why these programs reduce infant mortality. We need to address the overall health of women across their life course, especially in the early years, so that they're healthy, because when we have healthy women, we have healthy children and healthy families. And so it not only adds to their health, not only adds to the family health, but to community health. And so we're trying to this broader perspective.
It makes a difference.
A growing number of experts have helped expand the list of programs at the center, such as the Florida Perinatal Quality Initiative, aimed at ensuring the safest delivery care, and Florida Covering Kids and Families, providing in-person health insurance assistance.
So as we start trying to move in the issues of women, children, and families, we'll need to think of these as complex systems, and how do we use big data and other strategic approaches to understand how the over part works. So as we work at the individual level, the understanding level, and health literacy, all the way up to the big levels of how can we impact and make a greater difference for women and children.
For USF Health News, I'm Sandra Roa.